What would your gut say if it could talk to you? Hi everybody, this is Dr. Sam Forlenza with Chronic Health Solutions, and today we're going to talk about the actual communication that your gut gives you. This is just another video in our Leaky Gut series for gut health, and I just wanted to kind of talk about how important your body constantly communicates with you, actually through the gut. A couple facts here is people don't understand is that about 70% of your immune system resides in your gut. Okay, it's like a little voice that talks to you in the form of certain codes, or really in the form of certain symptoms that manifest. Okay. From silence to hunger pains to regular pain. So we're going to talk about the top 10 communication signs that your gut is trying to talk to you and let you know. Okay? All right, here we go. Number one, bowel movements. Okay, not a fun topic. But basically, bowel movements can occur, any time from daily to weekly. Sometimes bowel movements can occur up to 3 times a day, maybe just 3 times a week. Each person or each gut has their own rhythm, okay, and what's normal to them, okay? So I just want to kind of tell you, sometimes if your rhythm or your schedule for bowel movement is off, it may be through constipation, and constipation can be caused by many issues, anywhere from dehydration all the way up to something more serious as a autoimmune thyroid issue. Okay, so if your gut is talking to you as far as your bowel movement, you want to pay attention. Okay, number 2, processed foods. You might have heard me talk about this many times, how the standard American diet, the SAD diet in America, is just full with processed foods that are very inflammatory in nature. Okay, so these foods do not give your GI tract a break, and they're not helpful. A lot of times, people eat these processed foods that contain high fructose, corn syrup, artificial sweeteners, or ingredients. And what happens is that now, sometimes combined with leaky gut, and it's where those junctions loosen up in the intestine, in the small intestines, in the gut, and particles and bacteria leak through. But what happens is that, as I've said over and over, when you eat these processed foods, that they're not gut friendly, and sometimes they can cause a severe inflammatory or immune response. And a lot of times it can be a precursor to an autoimmune, which is a problem, which is a more serious health challenge. Okay. Number 3, gluten. Even if you don't have any other diagnoses like celiac disease, gluten can cause havoc on the gut, the gut will not allow you to absorb nutrients properly, because, like I've said again in the past, that this gluten is a sticky protein, and it comes in there and almost acts like a sandpaper and carves away these villi that are important to absorption in the gut. And now this malabsorption of food is taking place, especially as the way as nutrients. And once again, these if food is not properly absorbed, It can now cause an inflammatory process within the gut. And you've got this whole cycle again. So be aware of gluten. And by the way, 40% of the population may be gluten intolerant. And what I found too, if you're trying to eliminate gluten, you also might want to try to eliminate dairy too. Those things. If you do one or the other, it gets a little confusing. So if you think that you're gluten intolerant, you may want to also eliminate dairy. Again, many times we have people come in here. We have food testing. Again, our whole premise is food testing, nutrient deficiency, and toxicities. And a lot of times we can test for gluten intolerance and start putting people on a master food list, and you'd be amazed on the responses that can do. A lot of times people are just trying to lose stubborn weight that won't come off, and we put them on this master food list because they may be intolerant to healthy things. Chicken, okay? I myself is intolerant to tuna fish. So healthy foods may cause your gut to be irritable, to have an inflammatory, irritable type response. Okay, so listen to your gut and listen if you're getting any type of these symptoms. Prebiotics. A lot of times when we're taking antibiotics, these things will wipe out the very good bacteria that we need, and throws off the whole stability or whole harmony effect of the gut, because we need this particular bacteria or flora in the gut. But a lot of times certain medications will disrupt that balance. So prebiotics, things like, believe it or not, onions and garlics and asparagus and bananas play an important role, okay? Also things. Then once we get the prebiotics, then we'll talk about probiotics, which is also very, very important. Things like sauerkraut is a good probiotic. Fermented type foods helps also. Once the prebiotics start getting in there and putting in some bacteria, and those probiotics come in there, start getting that balance going again for us, okay? Number 6, if you're feeling tired or your mood swings, okay, you've heard me talk about this many, many times. We treat a lot of ADHD with behavioral problems, because the literature states out there that there's a lot of gut-brain connection. Again, leaky gut. The gut is more impermeable, and what happens is that food particles go through the circulatory system, and pass into the brain-blood barrier and start messing with behavioral and mood. And sometimes people feel melancholy or down. So listen, if you're experiencing this, it also could be a sign of a gut problem. Number 7, don't be afraid to sleep in a little bit, especially on the weekends. Don't feel guilty. It's been proven that sleep and rest helps improve gut function. Okay, it's also been stated that poor sleep increases the bad bacteria in your gut. Okay, also good sleep helps to lower cortisol. Okay, which is induced by a lot of things: stress, bad gut function, and this is an inflammatory process that happens. Okay, listen to your gut. A lot of times we try to tell people, number 8 here is what we call slow and steady, meaning that when you're eating a meal, try to slow down. We're always rushing around trying to get somewhere, fixing a fast meal here. Slow down, okay? Take time to chew your food. The smaller particles start the digestive process with the saliva, okay? It's very, very important. That helps proper digestion, okay? So just listen to yourself, okay, and your gut, okay, about the way and how you're eating your meal. Okay, and then also number 9, you know, you want to relax your mind. There's something to be said about that. I myself have noticed that when my mind is more relaxed, I feel better. I'm more creative. It reduces brain fog. It helps eliminate stress because, as we just explained, that stress, cortisol is released when your body is undergoing a lot of stress. So that's certainly not good for your gut because it slows down digestion and helps stop weight loss and actually helps increase weight gain. Relaxing your mind is important. And last, no news is good news, okay? So if you're just moving right along and you have great bowel movements and you're not fatigued or you don't have brain fog or, you're feeling pretty good, well, then that means, there's a very good chance that your gut is in pretty good shape. So no news is good news for number 10. Well, there you have it. There's some 10 signs on how your gut will actually try to communicate with you, tip you off, and start saying, hey, there's something going on here. So again, we do testing. I can't tell you how food testing alone is the beginning to reduce inflammation, which actually a lot of times start in the gut. And inflammation is a precursor to many serious health challenges. Okay, well, there you have it. So if you felt that this video was informative, please give it some likes and some shares. We want to help the community. Pass it on. Share it with your friends. If you're viewing it on YouTube, please subscribe to our channel. Ring that bell so you'll be notified and you'll be informed of when we have this next videos so we can help you. A lot of times people have taken advantage by contacting us to participate in some of our weekly classes or seminars. You can do that by going to drsamclass.com. drsamclass.com. Okay, there you can register for one of our weekly seminars or give us a call. The numbers are on the bottom of the screen here. We'll be happy to offer a free one-on-one consultation to see how we can help you. We're here to help and answer any of your questions. If you have any other questions, put them in the comment section, okay? Let us know what you're thinking, okay? We'll be happy to answer your questions that way also. Okay, well, this is Dr. Sam from Chronic Health Solutions, and it's been great talking to you, and we'll be back soon. Take care.